Hi, everybody. My name is Jennifer Cunningham. I'm the AVP for Alumni Relations at Lehigh University. And today I'm here with Jessecae Marsh. She is an associate professor in the College of Arts and Sciences and the director of the Health, Medicine, and Society program at Lehigh. She got her PhD from Yale and her BS from Vanderbilt. And she's going to talk to us today about the psychology behind health-related decisions. And she'll go into a little bit of the research that she's doing on COVID and information sources and how people who get information from different sources interpret that information differently. And also talk a little bit about the grants and the other projects that she's working on around disease and communications. So the way that these work, if you haven't been on them before, Jessecae will talk for just 5 or 10 minutes and give us an overview of what she's working on, and then we'll open it up for your questions. And we have now 67 and counting attendees, so you can imagine that if everybody did this verbally, it would get a little messy, so we tend to use the chat feature for you to ask your questions. So to access that, just go to the bottom of your screen and click chat, and you'll see a box come up. You can either direct your chat to just me and Jessecae, or you can address it to everyone to see your comment. Either way, I will be reading the questions and comments to Jessecae so she can focus on giving answers. The success of these does depend on your participation, so I hope that you will be quite active in the chat. And after you hear what she has to say, I have no doubt that you will. It's going to be fascinating. All right, Dr. Marsh.
Thank you, Jennifer. So just to kind of start off, I want to tell you a little bit about what type of psychologist I am, to kind of frame the things that I research. So I'm a cognitive psychologist. Cognitive psychologists study cognition, or the way people think in their mental processes. So we study things like, how do you shift your attention between different Zoom windows? How do you remember information? How do you learn things? And the area of cognitive psychology that I'm interested in and what I study is how people reason and how they make decisions. Specifically, my work is looking at how people's beliefs influence the way they reason and make decisions. And I do a lot of my work both in kind of basic cognitive psychology and then also applied into the health domain. So let me give you kind of some examples of what I do and what I'm interested in looking at. So when I think about people's beliefs, a type of belief that I'm really interested in is people's causal beliefs. So how people think about cause and effect, what they think are the causal factors of different things in their world. And it's easy to start thinking about examples of that when you think in the health domain. So I've done some work looking at things like, how do people think about the causal factors that underlie mental disorder categories? And what we know is what causal factors you think underlie mental disorder categories changes how you think about these categories. And so when I say mental disorder categories, I'm using that kind of cognitive psychology talk of just saying disorders, diseases of the world. So if I believe that a disorder like depression is caused by biological factors like hormones and stress levels or internal hormone related to stress, and thinking about neurotransmitters, then if I am looking at a treatment to take for depression, I'm more likely to say something like a medication works. It matches that biological cause. However, if I think that depression is caused by my environment, or if I think it's caused by psychological factors, the way I think about the world, I'm less likely to think medication is going to be successful and more likely to think something like therapy or changing my environmental context will be more successful. So that's just one example of this idea that the causes that we believe to underlie things in our world dictate how we think about those things, whether or not I think this is something that'll be treatable in certain ways, and then affect the decisions we make. What treatment will we choose? That is an underlying principle in my work, is that I'm interested in this idea of causality and how we think about these causal relationships and how that influences the way we think about different categories, and often by categories I mean health disorders. In a grant project that I have with a collaborator at Stevens Institute of Technology, we've been looking at how people conceptualize specifically diabetes, thinking about what they believe to be the underlying causal factors for type 2 diabetes. And what our grant project is actually going to be looking at is finding out from people what they think these models of causality look like for diabetes, and figuring out if we can give this information to physicians so physicians could actually help correct this information. So if they know their patients believe, incorrectly that eating a lot of carbs will give them low blood sugar levels, that's something they should know about a causal relationship their patient is representing, because it's the reverse, that eating a lot of carbs can actually raise blood sugar levels. So how can we give this information to physicians to kind of help them with their patients in a live action way, kind of change beliefs that might be incorrect? In recent times, since I'm interested in health beliefs, I'm interested in how people are thinking about their world and how that influences the way they make decisions, I have several research projects that are looking at COVID. I'm involved in a larger research interdisciplinary team here at Lehigh with engineers and other social scientists. And we were looking at community resilience related to natural disasters. It's hard to do natural disaster work right now, going into communities and asking them, how do you feel about, Hurricane Florence that happened a couple years ago? So our team actually pivoted to thinking about COVID as a natural disaster and asking questions about how people are thinking about COVID and how that might be affecting what we would think of as recovery behaviors, things like social distancing, following advice, stocking up on food, things like that. So we've been looking at that in a project. Related to my funded grant, we've also been looking at where people get information about COVID and other diseases and how that influences the way they think about the causes, the way they think about risk factors for different diseases. So are they getting their information mostly from CDC websites? Are they getting their information from press briefings? Is there information coming from social media? And so that's an incoming data stream we have looking at this longitudinally to see over time how people are getting information about COVID, comparing it to other diseases to see how it differs from other diseases that people may want to get information about, to be able to understand how when people kind of correctly understand things, where are they getting that information from? I think I'm hitting my 5-minute mark, but that's a little bit about kind of how I think about my research, what I'm interested in, thinking about those ideas of how people are thinking about cause and effect and how that influences the way that they reason and make decisions.
Okay, great. Thank you so much. We will now open it up to questions. So again, using the chat box, you can type your questions. And while you're all doing that, I had a couple of things that I wondered. So you're getting this stream of data, you said, from news sources. Are you also pairing that with other demographics and sort of chunking out that older people think this way, or this region thinks this way, or ethnicities, or how does that all come together?
Yeah, it depends on the project of the extent to which we're looking at that. In the source and disease information, we do have some of that. And you could make some really interesting predictions about social media use and different things like that, like to bring to your question of age. That's something in the larger data collection I'm doing with the group here at Lehigh that we're very interested in, because we're interested in these questions of community resilience and thinking about community members. And so starting to think about how communities look different, how people of color in a community might be experiencing COVID very differently. We know that COVID is, the death toll and the consequence of it is much higher for people of color. So how are they thinking about the recovery and social distancing behaviors? So those are things we're going to be looking in our longitudinal data collection, that project, because we have large enough sample sizes to be looking at interesting geographical differences, race, ethnicity differences, and also partisanship differences that are kind of coming out a lot in a lot of the published work coming out on COVID of how people are thinking about reacting to it.
Right, interesting. Jill's question, how do you suggest handling the fact that every person thinks and acts differently towards social distancing?
What a good question. So what I think we're seeing a lot of right now is that people have kind of gotten used to the idea of social distancing, and then now we're getting into this phase where people seem to be a little over it. And what I would be really interested from a research perspective is figuring out what pushes people over that hump. Is it a saturation that they've just seen too much in the news and they just can't handle it anymore? So they just can't do the social distancing anymore because things feel either better, so it doesn't seem as important, or things feel really bad, so they're saying, what's the point anymore, in almost a defeatist type of way. I think social distancing and engaging those types of behaviors has to be something we need people to help us make sure that's a structure that is in our society, in restaurants, in stores, so that we feel comfortable in being in those environments. It's an interesting question of how much individuals can do about that. What we can control is our own behavior, making sure that we're engaging in social distancing, that we're signaling that that's important to us at the places that we shop, at the places that, you know, we're doing curbside takeout or maybe outside dining now in Lehigh Valley area. Just making sure that it's like we're signaling the things that are important to us. Because in a lot of ways, as an individual person, that's all we can control, is how we're thinking about our own social distancing.
Yeah, and Jill goes on to add, you know, there's bullying and there's stress invoked by looking down on or just looking differently on how different people are and not social distancing correctly. So the spectrum of going out in a hazmat suit versus, you know, not.
And there's a lot of, you know, psychological things and tricks we're playing ourselves when, you know, we look out our window and see someone who's walking by without a mask. And we think like, why don't they have a mask on? They should have a mask on. Well, maybe they were just out for a run and they, you know, they haven't been around within 6 feet of someone. And I've heard from physicians talking about, you know, giving advice to patients of not running in masks because they're afraid they'll actually pass out. You know, so we will make a lot of assumptions about people and seeing them in very small snippets. And we have to remember that there's a context to that person that we don't know and that we don't understand. And unless we're willing to go up and ask them, we won't find out. So I would suggest that people need to hold their judgment. If someone is being dangerous in public, that's where we need to say, like, you are engaging with people sitting at these tables at this outside restaurant in a way that's unsafe. I'm going to go tell the restaurant owners because this is not what this should be. Yeah, it's something I encourage people to do, is remember that when you see other people acting in ways that you may not agree with, think about what their context might be. You know, think about, you didn't see them for the last 3 hours. You saw them in this snippet. So what does that mean and what does that indicate?
Yeah. Bob's question, how do you think people are assessing information for the truth from multiple sources so they can make the proper decisions and gauge where they are? And then there's a question down here, Steve Ross, for example, why would someone listen to President Trump instead of our scientists? And Raymond is saying it's oversaturation by the media with everything. It's endless. So I think, you know, a lot of us are just overwhelmed by the number of news sources, things that come out that say the president will say, and then the WHO says something, and then this guy retracts that, and it's like we hear something and we want to hold on to it, and then the next day some other authority discredits it. What do we do?
Anxiety producing. It really is anxiety producing. It is always a question that is of interest in any situation of how we weigh information from different people, different informants, and how do we weigh who we should trust more. That is always a puzzle in kind of our world. I think the saturation issue is something that can make people kind of turn off and disengage from the news, which might be good for their own stress levels. It might not be great if there's new guidances that come out that they're then not listening to. People tend to exist in echo chambers. They tend to listen to media sources that support their point of view. So the idea of like, why might you listen to one source more than another? People don't tend to look for information that would disconfirm their own beliefs. They look for things that would confirm their beliefs. So if you listen to a news source, be it MSNBC or be it Fox News, and it fits your beliefs, you're going to keep listening to that news source because that feels good to get that validation. Why would you go out there and challenge your beliefs? But that's the harder process, right? Is to go out and listen to a news source that, you know, and assess it and say, is this something that I should value or not? People don't do that. That's not something comfortable. We can all think about what, you know, listening to a news source that doesn't fit with our political perspective or scientific perspective and just having that experience of like, why would I listen to this?
Right. Right.
But so people end up listening to the same things they've always listened to. And so that is something that makes it harder for meaningful debate and actually talking about different perspectives.
And probably also when, say, Sean Hannity disagrees with President Trump, it makes the headlines because, wait, there's a rift in the talking points and they're different. And likewise on the left, similar. So, you know, if I am in my echo chamber, but then there's the echo chamber is freaking out. So that exactly. I think causes even more stress.
Yeah, and it's also, you know, one break does not make someone completely a dissenter, right? Like we also get this kind of, oh, this person disagreed. Oh, this person is contradicting this person. Is it on everything? Is it on a detail? Those things are so hard to grab from these media headlines of like, what is the actual importance here? We have lived up to this COVID pandemic in a time where a lot of people in the science community know that people didn't trust scientists, that there's a lot of research out there suggesting people didn't trust scientists. They didn't trust research. They didn't trust experts. I hope that what it looks to me like is that people are listening to public health officials. They're listening to experts from science on COVID. And I hope that's something that we can maintain. I really hope it's something.
Yeah.
As a scientist, I'm very biased in that account.
And Corey's question is, can you comment on that denial that some people have about social distancing? But then it does seem like there is a shift with COVID that more people are believing scientists than they have. So can you just comment on why some people are still denying science and some people who used to deny science are, you see them on you see them protesting, reopen our businesses, but they still have masks and they're social distancing. So there's something going on.
Yeah, I think we are getting some effects that are regional by the availability in your environment of what COVID looks like. If you're living in a community that has a high rate of COVID, it seems fairly obvious to you why you should be doing social distancing because you've known people, you've seen people. If you're living in a community where those, you know, hospital beds aren't eaten up, it's harder to make it real in your daily life. And I really think that's part of what's going on here is that people are like, I've been doing the social distancing or not, depending on the state you live in. And I don't understand why we need to do this. People here aren't sick. And this is the problem with disease, is that it spreads before people know that people are sick. If we always use that mentality, right? I don't see it in my community, so it's not important. That's not a great way to, I would not say that's a great way to live. But I understand that it's hard if you're not seeing it in your community, but rather than saying we're not seeing it here, we need to open everything up and stop doing social distancing, there might be an approach of we're not seeing here and we should be thankful for that and thinking about how we can use our resources to maybe help communities where they are seeing it more. Right.
Katie's asking, do you have preliminary data about what percentage of people are taking the recommended health precautions seriously?
So in our longitudinal data that we've been collecting with the group here at Lehigh, it actually looks like the vast majority of our respondents are doing social distancing. We can pull out differences of who's doing more versus less depending on some of the beliefs that we've looked at. But vast majority of people are doing social distancing behaviors. Now, this is an online study that is about COVID. So there's a selection bias here, right? There are people who are saying, you know, I'm interested in this. I've been engaged in this, so I want to do these studies. We saw it early on. So we've collected 3 different time points over the last 8 weeks on this. We saw early on that there were people living in communities that did not have a lot of social distancing going on or stay-at-home orders, who in our surveys were reporting, I don't understand why people aren't taking this more seriously.
Right.
And that is, I think that's telling you something about the people that are answering our survey. This will always be a problem in this type of data collection, is you'll get people who are more willing to talk about this to the people who are going to do a survey on COVID. And that might be that they're more willing because they had a family member who had it. it might be they're more willing because they feel good about engaging in all of this social distancing and want to talk about how good of a job they've been doing. But overall, our people in our survey, and we have collected from, I believe it's 49 of the 50 states. We have some people from 49 of the 50 states. Overall, we are seeing people engage in our survey, engage in social distancing. The short answer on that is I wouldn't take our survey rates to be very indicative of what's actually happening across the country. At the same time, we have to think about how much we trust things that are very available and obvious to us are things that will kind of sway our thought process. So seeing, one picture of everyone wearing a mask in a community, you can say, oh, this community is doing a great job. That might be one picture on one day. So it's hard for us to really read correctly what's happening because of the lens the media is going to give us what's interesting, not necessarily what's the best depiction of exactly what's happening in that community.
Right. Tara's question follows on that. Are you seeing any preliminary findings or trends in terms of the demographics and responses? And do you have any thoughts as to why these different groups are different? You kind of mentioned geography, but are you noticing anything that?
We haven't so far in our data done a lot of work at looking at demographic trends per se. We have looked at partisanship because lots of data out is suggesting that there's a difference between conservative and liberals in social distancing, and we're replicating the same thing, that people who are more liberal are more likely to be engaging in social distancing behaviors. So that's something we're looking at alongside a lot of the other things that we're looking at. We haven't done a deep dive on other demographics besides that, but it's going to be something interesting once we have all of our time points that we can do and see how those things might be changing in different communities over time. And it's really important to be taking that look. So we're not making claims of one, majority community that must apply to everyone else. That's not fair. That's not good science.
Right. Kathy's question, would the results of your research suggest that we better educate providers so they can provide accurate information or directly educate their patients?
Yeah, that's a great question because so I spend a lot of time kind of pre-COVID thinking about the mental disorder space and thinking about issues related to stigma and how people seek out treatment related to mental disorders and thinking about it from these causal kind of biases way. And if there is something that we get almost no education in school, I would say it is understanding what mental disorders are. Understanding what depression looks like in a person. People think, some research out of my lab suggests that people think they can just look at another person and know whether or not they're experiencing a mental disorder. The rates of actual mental disorders suggest there's no world in which people are accurate at doing that. You would think there were so many people around you that have a mental disorder if you were actually good at detecting symptoms of mental disorder and understanding when people are in trouble and not kind of publicizing that effect. So we can think about how do we educate the lay public, think back to the health class you took in high school at some point in time. I can say from my personal experience, my health class was not the most useful thing I've ever done. I don't really remember anything specific we learned out of that class. Could that be a place where we give people in high school an education on, stress, how to handle stress, what that looks like in other people, how to understand when other people are having trouble that you might be able to help with and help refer them to see someone, what basic nutrition looks like. It's been a while since I've been in high school, I will admit, so maybe some of these things are now happening in health class. But I teach a course at Lehigh called Healthcare Reasoning and Decision Making, which probably makes sense for everything I've told you today. And in talking to undergrads in that class, they talk over and over again about how they haven't gotten this type of education on really, what mental disorders actually look like, health conditions, how to think about these things, about stress. And so my sense is it's the space that we actually have that we could use to educate lay people about what's going on. At the end of the day, a physician's job is to communicate information to their patient in a way that their patient can and help their patient make the best decisions possible. So a lot of this is on providers. Providers need to be talking to their patients. They need to talk to their patients about uncomfortable things. we all know that being overweight is a risk to many different diseases and disorders, but how often do our physicians actually talk to us about our weight?
Right.
It's uncomfortable, so they
Right.
don't do it.
Right.
That's a problem. That's something we can think about, of how to educate physicians to talk to their patients and figure out what their beliefs are of, like,
Right.
what is causing them to be overweight or not, and then think about how to change those things. Understanding where people think causes go, where they think these things in their lives, how their health is being created by things in their environment is really important. And physicians often kind of ignore those beliefs in their patients. In my kind of thought space, they ignore these things in their patients too much, rather than trying to figure out what it is that they believe that they might be doing in their daily life that might be actually counterproductive to their health, but it's because they don't know it. They've never been educated to know that never been told that that's not how this works.
Right. Interesting. Ron's question is, you gave an example about stress. Has your research, which seems to be a secondary issue with all the things going on, has your research touched on how people think about and respond to a hypertension diagnosis?
I haven't specifically looked at hypertension. Generally in my research, I'm looking across a bunch of disorders because I want to see, I'm not interested in specific disorders. I'm interested in kind of, when you think about a medical condition, how are you thinking about that? And the same with mental health conditions. In our grant work, we are specifically looking at type 2 diabetes. So hypertension is going to become relevant in there. And we're exploring that type 2 diabetes space because my collaborator on that project is a computer scientist who does machine learning. And what you can do with type 2 diabetes is harvest large amounts of data from patients' records to find out what are the actual causal factors underlying that patient's health conditions, and see if we can actually feed that information back to patients and physicians to help them in decision making. So diabetes is a good disorder set to be doing that with. That's why we're using diabetes. But generally in my research, I'm trying to look across disorders to find out what are these, when you just hear that somebody has a health condition, maybe that's all you know, is like, I know they have some type of chronic health condition. You're already starting to engage thoughts about what that means. You're starting to think about what that means for that person without even needing a name more specific on that. So I'm usually interested at that level, but there's lots of interesting things that happen at the specific disorder level.
Yeah. All right, we have time for just one more question. I'm going to sort of combine Matt's and Raymond's. Matt says, I want to preface this question by saying I totally support the protests. However, a month ago, it would have been pretty radical to imagine groups of thousands congregating, but recently that attitude has shifted for good reasons. Possibly looking into how a mask wearing can give people a false sense of security, and that cognitive dissonance between attending protests and practicing social distancing, and why this has shifted. And then Raymond was saying, about liberals, based on your data, why would they be more likely to social distance? It seems that education on how viruses spread would be the best indicator of this. So I'm sort of putting those two together because it's a lot of liberals that are protesting, and all of a sudden we're coming out of our homes where we've been bunkered in for months, but now we're wearing our masks thinking, well, it's fine for me to be in thousands of people because I'm doing something socially important.
So I would come at that in kind of two ways. So one, what we're finding has been found in a lot of research studies that you're getting this partisanship difference. I think it may have something to do with liberals being more likely to endorse science and scientific policies. That's well-known fact. So I think what we're getting is some of that. So this is advice coming from the CDC and WHO. That's science advice. So it's being more likely to be followed by liberals. I think the way we should think about people who are protesting and coming out in public to say publicly Black Lives Matter, that they are saying not that I think things are fine and so I don't need to socially distance anymore. What they're saying is this is an important enough issue that I'm willing to risk my own health to be on the streets for it. And I think that should tell you about how important that message is and how important those protests are, that people are willing to sacrifice their own health for the health of a community that has been brutalized. And I think that is probably the best way to think about this. If people are out there wearing masks and standing at 6 feet apart, I've seen images of that in protests, they understand social distancing. It's just like people who went and voted. There was something that was more important to them in that moment than their own health. And I think, if you see someone out in public who's doing something like that, I wouldn't personally jump to the idea that they don't think social distancing matters. They think there's something else they have to stand for that's more important than their own personal welfare.
Wow. Well, that is a powerful point to end on. Thank you so much for the questions, everybody. And thank you so much, Dr. Marsh. This was fantastic. And I hope to see you all on another Mountain Talk soon and in person as soon as it is safe to do so. And the science tells us that we can do that.
Great. Thank you.
Thanks, everyone.